Welcome. I'm Tom Sullivan, editor of Government Health IT, and this eSupplement, ICD-10, Compliance and Beyond. In many ways, the real ICD-10 work begins after October 1st, 2014, when healthcare organizations have to start actually using the new codes. Bearing that in mind, what you'll find in this eSupplement, brought to you jointly by Healthcare IT News and Healthcare Finance News, are many issues pertaining to a broad range of healthcare professionals, all of whom will interface with ICD-10 in one way or another. Take the obvious case of medical coders, for instance. Contributing editor Jeff Rowe reports 5 tips for avoiding the coder productivity cliff that so many in the industry are expecting come compliance day. The practices that employ coders and others face a superset of challenges. Among those, knowing how much cash to keep on hand in the event of payment disruptions. Senior editor Mary Mosquera writes that an exact figure depends on a number of factors, including an organization's size and how far along they are on the recommended timelines. ICD-10 touches many parts of the revenue cycle. So contributing editor Chris Anderson explains that the first step providers can take right now is to map out your revenue cycle against the anticipated changes, beginning right at the admissions desk and running all the way to patient discharge. Starting now rather than later will enable healthcare organizations to achieve more than minimal compliance. Think running data analytics against the more granular ICD-10 codes. Associate editor Anthony Brino reports on the long road to population health management based on that specificity, with a touching story of how one boy's newer treatment options, not yet reconciled under ICD-9, prove the very fundamental need for the 10th version of the classification system. Indeed, the cadre of proponents has long been asking what took the U.S. so long to adopt ICD-10. Join Brino along with Healthcare IT News esteemed editor Bernie Monaghan and ICD-10 Watch's Carl Natale for a historical discussion about that very topic. We as an industry may be able to lay that question to rest come October 1st, 2014, but as Stanley Natchimson of Natchimson Advisors and Weedy said, it will quite naturally be replaced. The first question you'll need to ask on October 1st is it still working, Natchimson said. You probably didn't test for everything, so you just need to make sure all of your systems and processes are at least working in some sense. I hope you enjoy this eSupplement, ICD-10 Compliance and Beyond. And I welcome all inquiries to tom.sullivan@medtechmedia.com. Thank you.